All right, well, let's get started then, because I have 202 and we have a lot of stuff to cover, and it's all just amazing stuff. So my name is Lori Reeves. I'm the Executive Director for the Florida Perinatal Quality Collaborative, and I'm here with our team to celebrate the end of the 18-month active implementation phase of Homeward Bound. It's hard to believe that it's already been 18 months. It just doesn't really feel that long, but we are working hard right now on getting our next initiative ready to roll out. And so we're also going to be moving into sustainability phase for Homeward Bound, for those of you who have signed up for that. So next slide, please. Just a little bit of housekeeping as we start. Please make sure that you have yourself on mute. If you do have a question, please enter it into the chat box and we'll answer it from there. Or you can use the reaction button down at the bottom that mine has a little heart above it. You can click on that and select raise hand, and then we'll call on you. And then last but not least at all, this webinar is being recorded. So we are doing that so that it can be available for hospital team members that weren't able to participate today, so they can still see the final results and who got the stars and get to celebrate with us. Next slide, please. I want to start by thanking the incredible leadership team for Homeward Bound. And Homeward Bound is an initiative that was created. It wasn't adapted from a bundle that already existed. It was created with the inspiration of the article from Dr. Smith, and hopefully he's going to join us today to say hello. And our leadership team, along with our advisory group and then all the work groups that supported that effort, they put together a whole initiative around that idea. And our nurse lead is Sue Bowles. She's with us today, and I think is going to speak a little bit today. I really want to thank Sue. She's an inspirational nurse leader who knows more about neonatal nursing than just about anybody I've ever met. She always has fantastic ideas, and I just want to give her a special shout out because she decided to step back from her leadership role as our FPQC neonatal nurse lead. She's going to stay on with us as a coach, but she's going to hand off the reins. And she's just been so phenomenal. And I know we're all grateful for everything that she does and will continue to do. I also want to thank our physician leads, Dr. Petula Panagos, who is also our Associate Director of Infant Health for the Florida Perinatal Quality Collaborative, and Dr. Vargabi Guy, who is the physician co-lead on Homeward Bound. And then last, from Argentina today, which is astonishing. I can't believe you did that, Leilis, but thank you. Leilis Vernon, who represents families for us at the FPQC. And of course, that family perspective is an essential component of every single thing that we do. And I know at the hospital level that you are all grateful for the work that she puts in and how it helps you have access to materials that are a better fit for your families. Next slide, please. Okay, I'm not going to read through all the hospitals, but we have a lot. Next slide, please. And I want to thank all of you for your work over the course of this initiative. Go on to the next slide, please. We had 48 hospitals complete the active implementation phase of Homeward Bound. That is 70% of all the neonatal intensive care units in Florida. That's an all-time record for the FPQC. There are 74 NICUs in the state that are level 2 or higher. So we've had 70% of them involved in this initiative, which means the impact of this effort has been very, very large across a lot of hospitals and a lot of babies. I am going to let Dr. Estefania Rubio, who is our Associate Director for Data, give you some details on the data results for this initiative. And go ahead, Estefania, I'm handing off.
Thank you, Lori. Good afternoon, everyone. And first off, a huge congratulations to all of you. Your hard work has really paid off, and I feel like we have turned goals into milestones, not once, but a couple of times throughout the initiative. The gains are really, really impressive. Most of our hospitals have hit the mark. And I really think it's worth celebrating. I think you did a fantastic job. But beyond that, the numbers really show the impact that you all have had. And so let's go to the next slide. And we're going to check our results. So throughout the initiative, you had abstracted patient information and submitted to the FPQC data portal. We have 48 reporting hospitals for this time period from January 2024 through April 2025. May data is still being submitted. That's why it's not included, but please know that we are expecting the May data and that will be included in the final report. Just our deadline is too close and that's why it's not included. But for the results that you're going to be seeing today, that's our timeline, data through April 2025. We have received data from 9,445 infants. It's a very large data set. I think it's one of the largest ones we have had for an infant initiative. And it includes information from the infant and the primary caregiver and parent, right? So we see that the caregiver, 12% of them were Spanish speaking primarily, 50% were covered with Medicaid. And again, for the primary caregiver, the race was unknown for 5%, and the insurance was unknown for 6%. However, I have to tell you, at the beginning of the initiative, our unknowns were much higher. We were around 8 to 10%, and throughout the initiative those dropped. And so we thank you very much for looking at the quality of the data that you submit and also in making an effort to document race, ethnicity, and insurance for the caregiver, since those are very important characteristics that we need to look at when we look at our metrics to make sure that we don't have big differences among groups. On the right, you can also see the disaggregation by race ethnicity for the patients that were submitted to the portal. You see we had good representation, 30% Hispanics, 25% non-Hispanic Black, 37% were non-Hispanic White, and only that 5% of unknown. We do have a 3 additional percent of people that categorize themselves as multiple race. So overall, I think it's a good representation of our Florida landscape. Next slide. So here's our aim, right? I remember when we put it out is by June 2025. It seems so far away. We are at June 2025 and we have definitely hit the mark. Each participating NICU will achieve a 20% increase in discharge readiness for NICU infants as measured by the completion of a parental technical readiness checklist and the emotional readiness score done via the questionnaire, right? And then we had a secondary aim, which was that we will achieve a 20% increase in the completion of a discharge planning tool upon discharging home. Additionally to those aims, we did have additional metrics related to the primary care key drivers that would help us in the discharge process and in making sure that our families were empowered, engaged, and trained to take their infants home safely. So today we're going to go through some of them. Next slide, please. Thank you so much. So here you can see the first aim related to the completion of the parental technical readiness checklist. This is for all the infants that were submitted in the baseline in our data portal, and absolutely like impressive improvement through time. And this is exactly what we want to see in quality improvement, sustained, continuous improvement that went up and up and up month to month. At the beginning, we were at 34%. Our baseline, we always calculate from the first 3 months of the initiative. So January through March 2024, our baseline is at 48%. And you can see that for the last month of the initiative, we have gone all the way up to 89%. That is an 85% increase from baseline. Absolutely kudos to all of you. Remember, we were aiming for 20%. We got to 85%. That's really impressive. And on the right, you can also see the distribution of the box plots. I like those graphs because it shows you the distribution of the hospitals across the initiative, right? We had 48 hospitals and some started higher than others, but you can see on the right that the distribution, the box all collapse at the top, close to 100%, is representing 75% of hospitals achieving more than 90% completion of the parental technical readiness for their patients. And so that is incredibly, incredibly impressive. And we also know that actually 45 of the 48 hospitals achieved the 20% aim. So incredibly, incredible work. We are so excited. Next slide, please. For the parental emotional readiness assessment, you may remember this from our mid-initiative meeting. We were concerned because the completion, the documentation of the emotional readiness assessment was not very high. We were looking at 40-50% for the first 2 quarters of the initiative. And we know that these new tools take a while to, take a process that works within the unit. Sometimes you need to get permissions. Sometimes you have to go through several hoops and barriers that you may have. You may have to redefine the tool. And so after the mid-initiative meeting, you can see that those percentages started to go up. And that is just for the completion and the documentation of the emotional readiness assessment. So you see that in the last 2 quarters, we have now 79% and 82% completion. So again, kudos to all of you, because we know that this was difficult to implement in many places, and we do see that improvement. Luckily, we saw that when the tool was implemented, 97% of the parents felt very ready to take their child home. So that training and education was really having impact on families feeling ready to go home. But again, kudos to all of you for implementing the process and for making sure that those questions that are so important to make sure that the parents are ready, emotionally ready to go home, are now being asked in most of the units that participated in Homeward Bound. Next slide. Our secondary aim was related to the completion of the discharge planning tool. And here you see a similar story than our first graph, right? We see impressive gains. We started at 50% in January. Our baseline the first 3 months is at 56%. We went all the way up to 89% with continuous sustained improvement. Amazing. And that represents 59% increase from baseline. And again, in the box whisker plots graphs on the right, you see the change from a white box, meaning a lot of variation across our state, to now a more flat box towards the top, where everybody, or most units are actually implementing this really well for the vast majority of their patients. So again, kudos to all of you. Fantastic, fantastic results. Next slide. All right, and I'm going to have Dr. Panagos continue sharing the amazing work you've done. Dr. Panagos.
Hey everyone, congratulations again to the whole state, and thank you again to Dr. Smith for the inspiration from the publication. We're going to go over the process measures that were outside of the primary and secondary aims listed here. So let's go through them because they're just as exciting. So the process of providing multiple copies of the discharge summary for each appointment. Our baseline was 45%, and by the end of the project, it went to 100%. And very few things ever go to 100%. So it really just shows the buy-in that we all had that this indeed was necessary and mandatory. So that's pretty awesome in terms of showing our values. Create a standardized format for the discharge summary. Again, baseline 70%, improvement to 100%. Administer the health-related social needs from maternity units. So how to transfer that information from mom to baby. And we were able to improve this from a baseline of 15% to 88%. And then calling parents of patients within 3 days after discharge. Baseline was 18%. By the end of the project, it was 90%. And we did get feedback from several units that outside of 3 days worked better for their population. So potentially this number is bigger if you broaden the range past 3 days. Next slide. Moving on to more process measures. This one actually taps into the structural measures. So providing a list of pediatricians who can manage the NICU baby. So the baseline was 18%. By the end of the project, 77%. And this was definitely a measure that was thought to be one of the more challenging ones. So if that's what we do with challenging measures, then good for us. Huge success there. Supply food vouchers and breast pumps to our families, an improvement from a baseline of 15% to 75%. create a specific patient care plan for each family. You can see that that number went up from 33% to 81%, and develop a process map to access the health-related social needs questionnaire from the maternity unit, 18% to 69%. So all great numbers. So looking at some more structural measures, identifying and calling PCPs prior to discharge. And our ask there was, it doesn't have to be every baby, but definitely identify a cohort that was high risk. And we were able to improve that from 6% to 52%. Engaging a family advisor in the QI team, 3% to 25%. And although that does seem like a low number, that is a huge undertaking. So congratulations to anyone who was able to move that dot. And then finally, engaging a community advisor in the QI team, an improvement from 12% to 75%. So big success, congratulations, and thank you again.
Let's go on to our next speaker. I believe we're going back to Estefania for another slide, and then we're going to hop back and forth for a few minutes between Estefania and Petula.
Well, speaking about sustainability, we would just share we received responses from 30 hospitals that will continue submitting sustainability data for an additional year every quarter, and then an annual check-in every year, just to make sure that we have a pulse on where we're at with the amazing gains that we have had with this initiative. Your teams have made amazing progress. So with sustainability, we just want to make sure that those efforts don't regress. And so thank you for those, the 30 hospitals that will continue submitting data to the FPQC portal, so we can continue to look at that. The portal is being simplified for sustainability in July, so that's the only ask that I'll have for you. We will send you another email in July to let you know that the portal is ready for you continuing to submit that data into the portal. But other than that, the remaining hospitals, we got responses that went from, we already have a process to track it, which is fantastic. That's what we're looking for, that you have a system or a process that will help you sustain those efforts once the active initiative is done. So thank you so much for your responses. Thank you for the commitment. And if at any point you need any other resources from FPQC, please don't hesitate to reach back to us. And then I'll pass it on to Dr. Penrose.
So this is a one-pager summary. It will be published on our website soon. And this is a way to share what the project was, along with what your success was to either your leadership or even your frontline staff and your families. So this is up and coming on the website soon.
Hi guys, I'm going to talk about the stars at SUE, and you are all shining stars. I'm not going to say stars, I'm going to say shining stars, because if you look at this number, we have 86% of our hospitals received 4 or 5 stars for this initiative, which is amazing. And some of you, the 3 or the 2 stars, thank you. You did the work. We're so appreciative of that. So thank you so much. It just shows how hard you all worked, and we're really, really appreciative of that. Next slide. So what did you get a star for? Well, we had stars for each of the metrics: meeting participation, data collecting and reporting, hospital capacity, completion of the parental checklist, technical readiness checklist, and completion of a discharge planning tool. So those were what everybody received stars for. Meeting participation, you needed to have over 80% active participation. You needed to come to our coaching calls, the mid-initiative meeting, periodic webinar, and also you needed to do your quarterly presentation of what QI you were doing. And I will tell you guys, through the 18 months, how you all grew and evolved into doing your QI presentations was an amazing process to watch how it took place, how you began to understand the whole process of PI, of performance improvement and how you can use that, and using your 30, 60, 90-day plans and the tools that were provided to really develop what you were doing and how you were doing it. So thank you so much. And so the next slide. These are all of the hospitals that got their meeting participation stars. I'm not going to read them. I'm going to leave it up for a minute so you can all see them, but it would take me longer to read them than it is for you guys to glance to see if your name's on it so you can look. But congratulations, y'all did a great job. Okay, next slide. Look at that. We had to do 2 slides to get everybody, so that's awesome. Okay, next slide was data collection and reporting. And basically that's completion of your monthly and quarterly data. And you couldn't have more than a quarter lag at any point. And I know our data team was great at reminding you all to get your data in. So I want to thank them because they did yeoman's work at doing that. And keeping everybody on track. So thank you so much. And then implement a strategy to share data. Like, how did you do it with your NICU meetings, grand rounds, post data, Gemba walks, whatever. So really and truly, thank you so much. Next slide. And these are our hospitals that achieved that star. Next slide. I don't think, and I have to mention this, and those of you from FPQC, our team, let me know. I don't think we've ever had 2 slides for all this stuff, have we? For the infant initiative? I don't ever remember it. I could be wrong, but I don't remember ever having 2 slides. So this is awesome. Great job, y'all. So next slide. Hospital capacity. And you had to fully implement at least 6 homeward bound structural measures. So implement a policy, guideline, or procedure to administer the SDOH assessment tool, develop process maps. We have, in the toolbox, we have some fabulous maps, so please use them. Implement a policy, guidelines, or procedure to supply food vouchers or breast pumps. Sorry, I have a crazy Jack Russell who's in the background who doesn't like having me talk, so I apologize for the barking. Create a strategy to provide families with a list of pediatricians. And that was a struggle for a lot of you, and you all came up with some creative ways. I mean, I've heard of hospitals going to the pediatric meeting and taking their discharge summaries with them. I've heard of other hospitals that have dinner meetings. You guys did great in doing that. Implement a guideline, policy, or procedure to identify and call a PCP prior to the discharge for patient based on specific criteria. Great job. Creating patient-specific care plans for the families. And I think that was so wonderful in this initiative, and you really looked at all the different avenues for the families. We again implement guideline, policy, or procedure to provide multiple copies of the DC summary. Again, policies and procedures, the 3 days after discharge, getting a family advisor on our QI team, and engaging community advisors. And there was some really unique things that were done. Again, there's stuff in the toolkit and in the toolbox that you guys can go to if you want to continue with this work to see what other places have done, but that's amazing. Next slide. Again, all of the hospitals, you can go scroll through and look for your hospital. I'll give you a minute to do that. Okay, next slide. So again, the completion of the parental technical readiness checklist. This is the one that I think the overall success of this was amazing. Having reached over 80%, I have never in my life, in all the years I've done PI, have ever been told to go over a goal of 20%, and to see something reach over 80%, guys, is just, I mean, it's unimaginable in my 44 years in doing this. So great job. And we did reach that 20% improvement from baseline, or we surpassed that goal. And you all sustained your work. So kudos to all of you. Again, next slide. Again, all of the hospitals, so you can scroll through, giving you a minute to look to see if you can find your name. Thankful, I'm very thankful to Stephanie. I want to, and all of the team, because They put this all in alphabetical order to make it easier for you to find your hospitals. So I bow down to them. So thank you so much for polishing up the slides. Shelby did great work as well. Next slide. And completion of a discharge planning tool. And again, the 20%, and we want to continue to sustain that. Next slide. And again, the hospitals that have done that. Great job, everybody. Next slide. So this is what it's going to look like. This is what it's going to look like. You'll have our signatures, and we'll be sending it to you so that you can do it. I know people have hung it in their unit. It's a great thing to hang in your unit, because when people walk into your unit, they see this, they get it, they understand it, especially when you have surveyors come in. They love this kind of stuff. If you're going for magnet or beacon, this is another great thing to have. So these are all great things to have. Next slide. So we're going to be printing off the certificates and sending them to you, but we also, oh yes, and Layla's mentioned for the families to see. They like to see this stuff too, because it tells them that we care about what we're doing. We also want there's a Qualtrics link in the chat, and if you want this to go to your C-suites, you can provide the name and credentials of the person a letter will be sent to, with the address and the requester's name and email address. So please, 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 this is a great thing to do with your C-suites, and we can probably send you an email when it goes out. And if you don't take it to the C-suite after the letters have gone out, and you wait maybe 5 or 6 days, I might go down and knock on a C-suite's door and say, did you get that letter? So that you kind of do two things doing it. And we're not going to send it unless you request that it's sent through the Qualtrics survey, okay? So if you want the letter sent, you need to do the Qualtrics survey. Otherwise, you can always walk the certificate down yourself. Next slide.
So we didn't want to finish the call, and we still have plenty of time, so we're not actually finished yet, but we want to take a moment to thank the coach mentors, and we have a little model star certificate for them as well, because we know that they worked with you, all of their hospital teams, over the last 18 months, every single month, for the most part, and helped you learn your QI methods, do your presentations, touch base on challenges that you might be having, helped you celebrate your successes. And I know that we could not do the level of quality improvement that we do in Florida without the support of this incredible coach mentor team. So I want, next slide, please. Want to recognize the coach mentor dyads for Homeward Bound, Bernadette Butler and Lily Chang, Jennifer Bilecki and Petula Panagos, Susie Johnson and Yosef Cortez, and Sue Bowles and Vergabi Guy. So, I mean, I'm just gonna, applause to all of you. Thank you so much for your leadership and guidance for our hospital teams throughout the initiative. Lots of things in the chat. Woot woot. I like that one. Stephanie, did we have another somebody going to say a word or two?
Nope, that was the end of the slides.
Dr. Smith, if you're still there, do you want to say anything at all before we close?
I would just say congratulations. That was an incredible amount of work, and like those numbers were so impressive. So kudos to you all, and please keep up all of this wonderful work. It makes such a huge difference to the lives of our patients and our families. And I'm almost driven to tears. I'm so happy and excited about all the wonderful things that you've done. And thank you for including me today. It was really nice to kind of see this culmination.
Well, we really, really are grateful that you were able to join us, because you were the inspiration for this particular design of our quality improvement bundle. The publication that you did a couple of years ago was our framework, or we used to build a framework to do this. Do any of our hospitals have any questions for Dr. Smith, or anything you want to say to Dr. Smith or any of the rest of the leadership team?
I just want to say thank you, Vincent, for you and Christy sitting down and deciding this needed to get done. pulling together a team of people to get it done, and then putting it in an open access journal where we all could take advantage of it. So thank you for that.
And there's some other additional comments in the chat, Dr. Smith. So I think we're all grateful for this work. And I honestly didn't know at the beginning how successful we would be. Some of the measures were challenging for our hospital teams, and you can see that by where we started with our baselines. And yet they pulled it off, and the changes were really incredible. So fantastic work from everyone. Anyone on our initiative leadership team want to say any words before we close?
I do want to thank all the units for this great, great work. It means so much to the families, and whatever you do with the families is going to impact on the babies that you care for so diligently, that you work so hard for. So it really extends and sustains this mentorship that the families receive in the unit once they get to, if they're lucky, once they get to go home together. So from the bottom of my heart, thank you so much. This was one more family-centered project, and I hope that most of you continue our journey to transform care in Florida together.
And I want to remind all of our hospitals, and you all have done fabulous work. You all did your PDSA cycles. You did some fabulous PowerPoint presentations. Conferences are coming up. Look for that poster and that presentation abstract. Get this work out there so we can spread it. We need to spread this for the rest of the country. So please, please, please get it out there. Let people know what we're doing in Florida. So we're taking the lead, and let's get it out there and let people see. And you have amazing success stories. Brag on yourself. Please do that.
Yeah, I just want to reflect on the fact that there were so many measures that we would talk amongst ourselves, either at the advisory level or the lead level, and we would say, this is a hard metric, they're not going to hit it, right? And then the project started rolling, and we're like, oh, they're doing it. And then it's like, oh, they're doing it a lot, right? And they're still doing it. And I just, from my standpoint, we did things I didn't think we were going to do. And, and to have that experience at the state level is really just magical and grew me so much, right? I keep telling FPQC, I'm growing so fast here because of this. And I just think if we did it with discharge, what else can we do, right? And so I just feel like we're on fire, and, cheers to more.
And I do have to say, this initiative was so impressive to others at the recent National Network of Perinatal Quality Collaboratives meeting that California, which is like the grandmother of all perinatal quality collaboratives, invited our team to come and present to their PQC about the work on this initiative. So I thought that was very high praise. So it just shows what an impact this is making.
And the other thing it reminds everybody of is evidence-based guidelines that exist. You can use, and you don't have to go out and read 150 papers because somebody else did it for you.
Sue probably read all 150 of them. All right. Any other closing comments?
On the 150 papers, I have to say Vincent did that.
True, very true. Thank you to the hospital teams. You all did inspirational work. We're so proud of it, and so proud to work with all of you. Looking forward to working with you again, either on the Soothe initiative, if you're signing up for that, or perhaps in sustainability for Homeward Bound. But regardless of how we move forward, we're grateful to be working with you now, and want to celebrate your success. Please be sure to do the Qualtrics survey if you want us to share your STAR certificates along with a letter to your CEO. And I know we've heard that these have been, in some hospitals, they've been framing them and putting them in the hallway so their patients and teams can see the work. And the reason we started sending them to the CEOs is because many times we know in the units, you're doing incredible work, but the word about the work doesn't always filter up, right? It doesn't always get up to leadership. And so by sending letters directly to your CNO, your CEO, whoever that is within your facility, along with copies of your STAR certificate, we tell them in the letter exactly what went into this. What did you have to do to achieve these STAR metrics? So that we hope that that helps you with engagement with your leadership, and that they can help you celebrate your successes as well. Thank you all so very much. Go out and celebrate some more.